Okay, so the first thing we're going to do is measure cervical range of motion. So first I'm going to measure range of motion actively. So I'm going to measure flexion first. So I'm going to line my goniometer up. The fulcrum is going to be at the ear. The stationary arm is going to be perpendicular to the floor. And the moving arm is going to be lined up with the base of the nostrils. So go ahead and bend your head forward and bring your chin towards your chest. All right. And he is at 45, which is around normal, anywhere from like 45 to 50. And we're going to do extension next. So the setup is the same. The ear, base of the nostrils, and stationary arm is perpendicular to the floor. And go ahead and take your head backwards for me. All right. And that is at like 21, so he's a little bit limited in extension. The next motion we're going to measure is rotation. So for that, I need you to sit up nice and tall for me. All right. So your fulcrum is at just the center of the top of the head. Your moving arm is lined up with the tip of their nose, and then the stationary arm is just perpendicular. All right, and go ahead and rotate your head towards the right. All right, and he has about 49 there, which is around a little less. Typically you want it around 60. And then same thing, measure to the left. All right, and go ahead and rotate towards the left. And he is at 49 there. And the last measurement we're going to take actively is lateral flexion. So for that, you're going to find the C7 spinous process for your fulcrum, which is your most prominent spinous process for the cervical spine. So that's your fulcrum. Moving arm is going to be just lined up with the center. The head, stationary arm is going to be lined up around the thoracic spine. So I want you to take your right ear towards your right shoulder for me. And he has 20, and back towards the center and towards the left. He has about 14 on that side. Next, you would measure all of these movements passively. So go ahead and make your chin touch your chest. I'm just going to come in and provide a little overpressure. You let me know if you have any pain.
No.
All right, and then back up towards the back for me. Head towards the back. Come in, a little overpressure.
No.
All right, and then I want you to bend to one side towards your right. A little overpressure towards the left. And then rotate towards the right. And rotate towards the left. Any pain with any of those?
No.
All right. And then the next thing we're going to do is manual muscle testing on the cervical spine. So normally I would have patient supine and in different positions, but just for the purpose of doing like a gross manual muscle test, you can kind of do it when you are doing the range of motion testing in your assessment. If you realize that they have weak muscles, then obviously you want to put them in a gravity eliminated position, but I'm just going to come in, bend your head forward, all right, and don't let me push you back, all right, and then take your head back, and don't let me push you forward, good job, all right, don't let me bend your head just a little bit this way, and don't let me push you back, and other way, don't let me push you, and then don't let me push you, and don't let me push you. Good. Does all that feel okay? All right. Next thing we're gonna do is some myotome and dermatome testing. So for dermatomes, those are just specific spots on the skin associated with nerve roots. You do these to rule out any neurological symptoms that the patient might be having. And for that, I'm just going to touch those specific spots on the skin and ask the patient if they have any abnormal sensation or feels different from side to side. So for C5, lateral arm, feel that, anything different? All right, palms out for me. C6 is the thumb.
Same.
C7 is the middle finger.
Same.
And C8 is the pinky. All right, and then can you extend your arms out just a little bit for me? T1 is medial side of the arm right here, same. All right, and you can relax there. And then moving on to the lower extremity, L2, anterior, same. L3 is medial thigh, same. And down here a little on the knee as well. L4, medial lower leg. L5 is lateral lower leg. And can I have you take your shoes off for me? And then S1 is lateral side of the foot. All right. Then next, I'm going to test the myotomes. So these are just muscle actions that are associated with the specific nerve root. This is also part of the neurological testing. So first, I'm going to ask the patient to perform the movement, and then I'll come in and apply some overpressure as well. So for C5, shoulder abduction, can I have you lift your arms out to the side? I'm just going to apply a little pressure. All right. Can I have you bend your arms up like this? C6. And then push into me, C7. Then can I have you flex your wrists, C6 and 7, and extend them. All right, and then can I have you curl your fingers and don't only pull them out? And then can I have you spread your fingers apart and don't only push them together? And this is for T1, finger abduction. All right, and then for the lower extremity, I'll do these one at a time. Can I have you scoot forward just so your feet are flat on the floor for me? Perfect. All right, L2, can I have you lift that hip up, hip flexion? All right, L3 is knee extension, so don't let me pull you out. L4 is dorsiflexion, so lift your toes up, don't let me push them down. L5 is big toe extension, don't let me lift your big toe up, don't let me push it down. All right, same thing on this side. So can I have you lift this hip up? Good. Don't let me pull your leg out. Good. Lift your toes up. Perfect. And then lift your big toe up. I won't push too down. And then can I have you stand up for me? And for S1, it's plantar flexion. So the best way to test this is just to have them do some toe raises. So you can hold on to the table for support if you need it. And kind of just have you do 15 toe raises. $14, $15. Any problems with any of those?
Good.
All right, and the last thing I'm going to assess is his blood pressure. So for the stethoscope, you want to make sure that you have the ears pointing together when you put it in. You also want to make sure it's on. When you're applying the cuff, you want to place it over the bicep muscle, about 2 inches above the cubital fossa. Make sure it's nice and secure. You want them to just be relaxed, feet uncrossed. You want to place the stethoscope over around where the brachial artery is. And when you inflate the cuff, you should inflate it to around 200, between 180 and 200. His blood pressure was 124/82, which is just a little elevated from normal. Normal would be below 120/80. When you're deflating the cuff, you want to do it at about 1 to 2 millimeters of mercury per second, and you want to make sure that the patient doesn't talk or try to move while you're taking the blood pressure reading.